Doctors of Reddit, who has been your worst? But I looked it up on WebMD patient. RN. But my favorite was when a patient's family member rudely insisted we give her mother, who had a major stroke, resulting in nearly zero swallowing capability, as much water as she could drink, because I read a study online that said you can't aspirate on water because your lungs just absorb it back into your bloodstream. I looked her dead in the eyes and said okay. Then explained drowning to me. The other day I had a guy come into the ED in tears because he had wrist pain, and the nurse at his work's occupational health looked it up and told him he has multiple sclerosis. In this day and age of the internet, I'm still surprised people don't use WebMD more. Just this week I was in our workroom when a senior physician sitting next to me was on the phone and suddenly grabbed my arm while desperately trying to keep a straight face. The senior physician was talking to a 24-year-old female patient and the conversation was going, "No ma'am. You can absolutely get pregnant even if you don't orgasm. No ma'am. Just because he's feeling nauseated the morning after doesn't mean you're pregnant." I mean, the WebMD page on this is pretty darn good. I'm not a doctor, but I did take my very elderly nana to the hospital after I showed up to her house and found her slurring her words and behaving very strange overall. Now, my nana is a major hypochondriac, and when she was admitted, the first thing she told the doctor is that she believed she was experiencing the beginning signs of Parkinson's. It turned out that she had mixed up a bottle of non-alcoholic wine with a bottle of regular wine, had drank the entire bottle, and was completely hammered. I had a woman come to see me because of abdominal pain. I spent a good 10-15 minutes of asking her questions to get a better understanding of what could be happening. I ended up ordering an ultrasound to assess for an ovarian cysts and some blood work. As she's leaving she goes, "Are you doing lab work for my prostate?" I had to bite my tongue so as not to laugh and said no. "Because you're not a male and you don't have one." She just said "oh" and left. Spoiler alert, she had an ovarian cyst. Edit, there you grammar Nazis. Happy? Quotations FTW. I had the reverse happen. I went into my family doctor of 10 years with an extremely itchy arm with a rash. I work with suck animals and told the doctor I was positive that his was either ringworm or scabies. They told me no, definitely not, and prescribed hydrocortisone for contact dermatitis and send me back to work with the animals. 3 days later, it has the telltale ring of ringworm and is infected due to the hydrocortisone they prescribed. I went back in and asked why I didn't come sooner. I raged. Not only did I start an epidemic at work, since ringworm can be passed between species, and the doctor insisted it was simple skin irritation, but I still have an extremely visible scar known as post-inflammatory hyperpigmentation that can take up to 3 years to fade. My doctor said he could fix it with a $300 skin laser treatment. I found a new doctor. This will make my friend sound stupid, and she really isn't. When she had her first baby and was in that woozy sleepless new mom phase, she took the baby for her checkup and completely misheard when the doctor told her the baby had eczema. She got home and started googling what she thought he had said, and called me in a panic, saying, "The doctor said the baby has emphysema." Why? That infant never smoked a day in her life. Full stop. Like a couple people have posted, I've been on the opposite side of this, but I think it still fits. Back when I was a teenager I was a really big fan of human comics, and she posted a SAR about a condition she was recently diagnosed with called polycystic ovary syndrome or PCOS, and listed the symptoms. Aside from the ones I couldn't account for, like fertility problems, I had nearly all of them. The biggest one being I hadn't had my period in over a year. My parents took me to the doctor, who immediately booked me for an ultrasound. Turns out I really did have it, and my doctor commended me for coming to him about it. I'm very thankful to Human for posting that SAR. I never would have known otherwise that what I was experiencing wasn't normal. Edit, I got out of work just under an hour ago and have taken the time to read all your replies. Holy crap, this blew up. I wish you all the best. Veterinarian here. This is the worst I ever had. But not because they were wrong. A large lady wearing a muumuu brings a kitten into the clinic. She plops the kitten onto the examination table and says, "Pretty sure it's got ringworm." I examine the kitten. And sure enough, it has a couple of classical ringworm lesions. Too young to give oral antifungals too. So I prescribe a topical therapy for it. Large woman asks if that would work on human skin too. I say it should. She says good. Because the reason she knew the kitten had ringworm was because she found a lesion on her own body that she looked up on Google. And it looked like ringworm. And before I can ask anything further, she flops out one large, saggy and obviously non-brassiere supported tit through the neck of the muumuu to show me the ringworm lesion on the top of her left bob. Yes. That's a ringworm lesion on your pendulous breast. Now please put it away. Edit, spelling correction of muumuu. But muumuu seemed appropriate. As a twist. Not a doctor. But I once went into the doctor for what turned out to be a less common skin virus. The doctor took one look and said, "Holy cow. I just read about this on the internet. Christmas tree rash." I'm sorry this doesn't answer the question, but it's related and I'll say up front. My fiancée is a nurse and she and her nursing colleagues have all agreed I was well within my rights to be the asshole in this scenario. I'm usually extremely polite to everyone, but you know. Pain. I went to the emergency department because I couldn't move anything above my waist and was in horrific agony. For no reason whatsoever my back stopped working. This was on Christmas Eve and left it till the 28th to go in. Go into Tridge and I'm waiting around 4 hours. Still in pain and trying to move in any way. Eventually Tridge nurse shows up. So, what's the problem? Yeah. Back is in agony. Can't move. I haven't injured it. Think it's maybe a slip disc or trapped nerve or something. I'm not sure. You're not, are you? So don't come in here trying to guess what it is. Okay. Are you a doctor? She stormed out without saying a word and the doctor came in 5 minutes later. Took a look and determined some swelling had trapped a nerve. Heavy duty diclofenac and I could have danced 30 minutes later. Just graduated medical school a few weeks ago. The most frustrating are the concerned parents who buy into all sorts of myths regarding vaccines. Especially frustrating are the parents who refuse the HPV vaccine for their daughters and sons. Not based on any misguided health concerns, but instead due to beliefs that it will encourage their daughters to be sexually promiscuous when they are older. I have a spin on this topic. I had a searing pain through the left side of my chest. It was excruciating. It started as a dull pain but quickly felt like my chest was on fire. I thought I might be having a heart attack, but I didn't die and the pain kept building. While lying in bed attempting to sleep and literally crying from pain, I googled my symptoms. My self-diagnosis, shingles. The next morning I went to the doctor and told him what I thought the problem was. To my surprise, he opened a web browser and went into exactly the same site I'd looked at the night before. And sure enough, shingles. As a patient who looked up his odd symptoms online. Never tell your doctor you looked up your symptoms online. Had odd reduction of feeling in my pinky, ring finger, half my middle finger, along with that half of each hand. Also reduction of feeling from halfway down my thigh and below. Also El Hermetz sign, check for spelling. Saw pretty dead on clues for transverse myelitis, lesion on the spine. Got sent to a neurologist who basically told me that I was feeling my symptoms because I sketched myself out searching online. Took me and my parents crawling up his ass to get an MRI scheduled. Lo and behold, a nice glaring lesion on my spine, C4 and C5. He told me he would learn to trust his patients more from then on. Off topic, but I have a patient right now who has been intubated in the ICU for a couple days after evacuating around 2L of pus and peeling off hardened pus from her lung, after trying to treat her pneumonia with healing crystals. Sucks. Has a really wonderful family and group of friends. She's slowly getting better though. A mother who was convinced her son had familial Mediterranean fever. He did not. She was repeatedly told this. Nicely of course. Yes, the child had had genetic testing by the time I saw the family. Oh. But a small percentage aren't detected by the testing. Thing is, her kid was fine. Healthy kid. Mom was just obsessed with this diagnosis. Not exactly Munchausen by proxy. She never did anything to him to make him sick. Or subjected him to a lot of unnecessary procedures. But on that spectrum. Not a doctor. But when my wife was having some odd symptoms and feelings, she started researching online. All her co-workers told not to do that because WebMD will have you thinking you have cancer. She did have cancer. It took about 7 months of repeated visits to various doctors before someone finally did a CT scan. She had cancer. If you think something is wrong, keep pushing. When her cancer came back, she had to guilt trip her oncologist to do a PET scan because he said it was too soon for it to come back. It was back. So if you know something is wrong, keep pushing until you get the right answers. This is somewhat related, but I'm not a DR. The only time I self-prescribed was when I thought I had rhabdomyolysis. Never had even heard of it before. I woke up that morning feeling like I'd been in a car accident, had done a very heavy workout 2 days prior, and literally wondered why it was the worst soreness of my life. I didn't start doing any web stuff though until after I went to the bathroom and realized my piss looked like Coca-Cola. What's funny is even going to the air I was thinking, this is a total waste of time and I'm going to be laughed at by a DR today for being a dumbass who looks up shit online. Then I spent the next 5 days in the hospital and went through 70 IV bags before I was finally discharged. Sad and long story, but to keep it very brief. Lady on 4 vasopressors including high dose epinephrine. Was gonna die in the next few hours. Husband was convinced that epinephrine was causing the low blood pressure and low heart rate. He kept going back and forth from home to the hospital with online printouts despite myself, my fellow, and my attending, and the nurses all telling him that this medication is keeping her alive. We looked at his first printout. It said, ephedrine, we're like our first of all. That's not the same medication. Anyways, I actually tell him that if I was him, I'd stay with her and that she may only have minutes left. He's threatening to sue us and he's convinced he's right. He goes home again to get a new printout, and she ends up dying while he's at home. Well, the opposite. When I was 17 I went to the doctor because it hurt when I peed. I had the assumption it was a UT. When I went into the doctor and told him that, he proceeded to tell me that there is no way it could be a UT since I am a male and 17. He then asked me if I was sexually active and I said yes. He asked with partner? I said yes. With protection? I said yes. Always. He told me, oh, you definitely have an STD. Ran all the tests and came back with such a look of defeat and told me I have a UT. Take that, you judgmental big dig. Follow up on a recovering triple bypass patient. Was giving the general you should try to eat more healthily. Watch your weight. Take moderate exercise. Avoid smoking sort of thing. Resulted in a 5-minute harangue about nanny state doctors telling us what to do and denying us simply pleasures. Healthy at any size. Internet says so. Just bad luck. Stop interfering. I appreciate that there is a time and a place for unsolicited lifestyle advice relating to cardiac health. But an appointment with your physician to discuss your recovery from a coronary artery bypass is that time and that place. Some people are beyond help. Nat. But a few years ago I got sick with bronchitis. I get bronchitis quite frequently. Typically every time I catch a cold, it develops into bronchitis. It was around Christmas time and I went to Emerg as our clinic wasn't open. The DR there was not from here, so did not know me or my history. I explained to him I had bronchitis and I just need medication and an inhaler. He was positive I did not have bronchitis and just a cold. Told me to come back if it got worse. The next day I went back and it was the same doctor. I explained I felt even worse and he reluctantly gave me antibiotics. But just enough to last that day. And a script to fill to get the rest of them. I live in a small town where our pharmacy closes for damn near a week at Christmas, so I couldn't fill it. Went back 2 days later for help because now I've coughed so hard I've broken a rib. Same doctor. My bronchitis developed into pneumonia. And yes, my rib was in fact broken. I've had bronchitis more times than I can count. And I know what it feels like when it starts. My doctor takes me seriously when I tell him straight up it's bronchitis. Late to the party, but may as well add this. I was working with a physician and we went to see a patient who insisted that he had tiny fibers and worms bugs coming out from his skin. He had extensively googled his symptoms, self-diagnosed with Morgellons disease, and had even gone as far as to join a support group. He was extremely articulate and intelligent. But when confronted with the fact that Morgellons disease is a delusional parasitosis, he acknowledged this but couldn't grasp that a delusion would mean that he is perceiving something that is not actually there. Delusion equals fixed false belief. I went to my DR about a month ago. Had a spot on my back end that had me a little worried. Marizo, since my mother had skin cancer on her hinny. I had also recently been around someone who has shingles. Prior to this, I had pain in my foot and went online and found it to be plantar fasciitis. When I saw my DR later that day, I told her what I found on the internet and she said yep, that's exactly what it is. Now, I joke when I am nervous and I was plenty nervous due to the incidence of melanoma in the family. So when I went in to see her about my spot, I told her that I had been on the internet and I was pretty sure I found out what it was that I had. She asked me to elaborate and I told her that I was pretty certain I had shingles cancer. She just about fell out of her chair laughing. For a stretch towards the end of high school and beginning of college, I repeatedly had sinus infections. We're talking one every 3 to 4 months for the span of about 2 years. The nurse I got initially told me not to believe everything I read on the internet and to stop googling my symptoms, just for my doctor to come in about 2 minutes later and say, "So you have another sinus infection?" Knowing I was going to be right without her checking. I've been on the opposite end of this when I was in college and wasn't feeling well. Looked up my symptoms and came to the conclusion I had strep throat. Went to the free clinic on campus and told the doctor there that I think I had strep. She chuckles and says, "Well, we'll see about that." So, she does the test on me and later comes back and says, "Wow, you were actually right." I guess being on campus she had a lot of people coming in saying that when really it was nothing more than a sore throat. In my experience, strep is fairly obvious, at least when it's advanced to the point of visible bacterial colonies in the throat. My mom diagnosed mine as a child. She made me tea. And I took a sip and saw stuff floating in the tea. She said, "Huh, that's weird. Maybe the acid in the fruit tea reacted with the honey. Let me make another cup with plain sugar," and it happened again. She looked at my throat and sure enough, it was full of white gunk. Off to the doctor we went. My sister is a paramedic. One day she and a team are sent to house. A man had called about a broken arm. I don't know how he broke his arm the first time, but had read somewhere on the internet that if he just kept breaking his arm then the pain would go away. He had tried around 3 times by jumping up and smashing down his weight on his arm. And it shocked everyone that he proceeded after the first time. In the end the guy had to get 4 surgeries on his arm. But my sister isn't sure if it wasn't eventually amputated or not, since she was pretty sure by the look of it and the x-rays that it would have to be. Not a doctor, but I am a pre-med student who comes from an anti-vax family. Occasionally someone will send me a link to research, usually a monologue, about why vaccines are terrible. Reverse experience. I went to the ER for anaphylaxis, obvious distress, and was made to wait an hour before seeing a doctor. Because the triage nurse and desk lady didn't feel it was important. Or maybe they thought I googled the symptoms and was able to sustain fake tachypnea, tachycardia, clamminess, and a dusky color. Yeah, I've posted a lot about this. It's a bit traumatizing. Not a doctor but worked in emergency services. Guy went to bed after convincing himself that his chest pain was indigestion. Took some antacid and climbed in bed. Wife was in tears the next morning when he was dead. Obligatory, not a doctor. But I have a relatively rare condition. So when I go to the doctor, more often than not I see them pull up what? Oh yeah. WebMD and Wikipedia. And then they read EXACTLY what I just told them. RIP. Worst self-diagnosis as a doctor. I was in a rough part of training. Not sleeping. Working 90+ HR weeks. And losing weight. I crawl into bed after 40 hours awake at the hospital. Too tired to eat. I notice my laptop on my lap is twitching. I realize I can feel my abdominal aorta pulsing. I freak out thinking I have an aneurysm. 0 risk factors. Then realize I am hungry and tired and thinner than I have ever been. I sleep like the dead.